Consumers are choosing the wrong plans and plans that don't work for them. So we need better information before plan selection. Quite simply, they don't have a clear enough understanding of what the plan includes, what it covers by way of prescription drugs, or perhaps whether their provider is actually in their network or out of the network. If they choose if they choose a plan that's, for example, their provider's out of network, it has big cost implications.
Costs are beginning to shift to consumers in the healthcare coverage area, particularly with high deductible plans and consumer-driven health plans. So consumers really need to be thinking about how they want to spend their dollars. Consumers want to know, what will this cost me in the end? When we look at consumers that are interested in the health exchange marketplace, that are coming into affordable care coverage, we know that the vast majority do not understand some of the basic health terms.
If anything, we're moving in a direction where they're getting more complex, greater number of tiers for provider networks, for your drug formulary, more complicated deductibles and, out-of-pocket maximums that may apply. The challenge will remain that it's hard for consumers, unless you're a patient with a chronic condition that you sort of know what your healthcare usage will be over the course of the year. For many patients, it's sort of a daunting task to think about what may come up and sort of plan accordingly and choose a plan based on that. So the cost calculator is going to try to take that into account.
We know that in a consumer choice market, poor customer experience is unsustainable, and this isn't unique to the healthcare sector. Poor customer experiences drives up detractors, which drive up call volumes and lapses. So this isn't rocket science. We've done the math, and we know by remediating the most abrasive touch points, we're going to increase affordability by reducing administrative costs, improve the cost of care by helping consumers identify the most appropriate sites of care, and improve access. And what consumers told us is they want confidence, clarity, and ease.
I think there's more major changes coming in 2017 with an out-of-pocket cost calculator and maybe some minor improvements around the edges. But we really need the searchable provider directories, the searchable formularies. We need a simplified format with easier to understand plain language that consumers can really start using to make comparison on the exchange plan websites. But we need good out-of-pocket cost estimators too, and we need to pair that up with quality information. And the good quality information isn't going to come until we start changing the quality measures, the things that we're actually measuring, so that it's relevant to consumers.